Okay. I didn't know if that was. Okay.
During the time of this pandemic, we see just how much more pronounced these disparities are, especially in vulnerable older adult communities.
Across all these communities of color, the infection rates are somewhat higher than for white populations, but what's much, much higher are the mortality rates. And you can come all the way back to lack of basic access to health care, but also lack of access to an internet connection that in these days can be the difference between getting any kind of help and not.
My parents tried really hard to give us as stable and normal of a family life as possible. As I got older, I became more aware that my parents actually didn't have a lot saved away, and they hadn't really thought about themselves and what the future might hold for them.
Almost half of older adults 80 and over still carry a mortgage. And when you're talking about those who have retired, who are on fixed income, what does that mean for people? And how difficult is that?
This isn't just an issue that is unique to one community. This is something that I think is a political problem, is a policy problem, is an information problem, but certainly is a really golden opportunity for different communities of color to work together.
We learned things and researched things with our partners around economic security, around access to health care and services, and around digital connectivity.
I have lived on the south side of Chicago in the same house since 1968, and I'm 90 years old. I was losing my home, and I was like 9 months behind.
Mary's story, unfortunately, is very common in the African American community because until we repair the problems of disparities, we'll continue to fall behind the average homeowner. We have this huge problem in the city of Chicago with affordability. When seniors come to the Chicago Urban League for counseling, that's the first thing they say: I don't know how much longer I'm going to be able to stay in my house. Because with my income shrinking, everything is going up, but my income is staying the same. We may be forced to go live with our children.
Many of these families are still owing on a mortgage past their 70s. And so that's a challenge if we want to make sure that there is generational wealth transfer.
It didn't start with our current seniors. It started from seniors before them and before them. There's a history. What we need is to have a real investment in the African American community. We need hospitals and medical centers that really care about the community.
It's so important for all of us to continue to be connected. In the state as a whole, about 1/3 of African American, Black, and Hispanic Latino older adults lack connectivity and broadband access. So when we look at how we can connect with others, older adults are losing that gateway. About 7 million older adults in the state of Illinois are homebound. The issue of telemedicine, staying connected, is more important than ever.
In many of our communities, the digital literacy gap is very, very high. A lot of our families don't have access to the internet, don't have access to the hardware. And so even new innovation in the medical field online has been a challenge for our community as a result of not having access to the internet in significant numbers.
Advancing Justice, Chicago is very grateful to AARP for helping lead on this so that we can make sure that the stories of our parents' generation, the stories of our seniors aren't forgotten or ignored.
It's very important that our state legislators understand that as we go through a recovery effort, that they see investing in addressing these inequities as something long-term.
The best way to arm yourself for effective advocacy is to have good facts and data. So armed with this, we expect to be even more effective on the advocacy front. There are all these disparities, but they are things that we can get at if we focus on the right set of policies.
Thank you to everyone who tuned into today's live stream. Before we start, make sure to check these settings if you're having any issues, and we'll get started in about 30 seconds. Ladies and gentlemen, thank you for joining the live stream. Here is Teresa Jones, the Associate State Director of AARP Illinois. Teresa, take it away.
Hi, good afternoon. I'm Teresa Jones, the Associate State Director of Advocacy and Outreach for AARP Illinois. Thank you for joining us today. I want to welcome you to this very important discussion about the coronavirus vaccine. A very special thank you to the Chicago Sun-Times for this special partnership. It's always a pleasure working with you. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. If you have participated in any of our virtual conversations before, you know that throughout the broadcast, we encourage your comments and your questions for our honored guest. Please type your questions or your comments in your social media feed, and we will do our best to discuss them live on air. Now, I think we're all grateful that 2020 is in the rearview mirror. COVID, of course, is still with us and will be for the near future. The virus has mutated, continued outbreaks nationwide. They show just how difficult that the prevention efforts can be. While vaccines are here and all those over 16 are eligible, COVID cases are still prevalent. Distribution vaccines have been challenging, especially for the African-American Black individuals, and many Americans continue to feel the emotional and financial hardships from the pandemic, and they still fear what is to come. Well, today, we're talking to an esteemed panel of African-American Black doctors to identify solutions and to help alleviate fears, as well as hear how we can combat COVID-19 together, including the latest on vaccine distribution in Illinois. I'm honored to have with me today Dr. Garth Walker, Dr. Damon Arnold, and Dr. Derek Robinson. Well, let's begin with Dr. Walker. We are fortunate to have here the Illinois Deputy Director for the Department of Public Health, Dr. Garth Walker. Thank you, Dr. Walker, for taking time out of what I know is a very hectic schedule these days. Thank you for taking the time to speak with us and have this very important conversation.
Thank you, Teresa. It's an honor to be on this panel with Dr. Arnold and Dr. Robinson. Very timely discussion, and looking forward to sharing some of the initiatives that we're doing at the state level, as well as addressing some very, very important questions.
Thank you, Dr. Walker. Today, we also have Dr. Damon Arnold. Dr. Arnold is the adjunct professor at the University of Illinois College of Medicine and School of Public Health. He served as director of the Illinois Department of Public Health from 2007 to 2011. He currently serves on the Illinois State Board of Health as a chairman of the policy subcommittee that's appointed by Governor J.B. Pritzker. He has been working as medical director for Blue Cross and Blue Shield of Illinois. Thank you, Dr. Arnold, for joining us today.
Thank you, Teresa. And I'm so honored to be working with Dr. Robinson and Dr. Walker. Both of them are icons in my life, so I look up to them.
Well, thank you, Dr. Arnold. Finally, we have Dr. Derek Robinson. Dr. Robinson is the Vice President and Chief Medical Officer for Blue Cross and Blue Shield of Illinois. Thank you, Dr. Robinson, for joining us today.
Teresa, thank you for the opportunity to be here. Happy to partner with AARP and Chicago Sun-Times for today's virtual discussion, and also to represent the more than 8.5 million members Blue Cross and Blue Shield of Illinois, where we serve people across every county in the state, including right here in Cook County and in the city of Chicago. And like Garth Walker, I'm an emergency medicine physician, and like Dr. Arnold, also a husband and family member. And we certainly understand the many challenges that we've had with COVID-19 over the last year. I look forward to engaging in this morning's discussion.
Thank you, Dr. Robinson. And again, thank you all for being here. Well, now we have a lot to talk about, so let's get started with some questions. And just so you know, we have already incorporated some of the pre-submitted questions from our Sun-Times readership. We appreciate your interest. So let's start with you, Dr. Walker. The spread of the coronavirus, well, it continues to be a top concern. Data shows that African-American Blacks, specifically men, have disproportionately been affected by COVID-19. A safe and effective COVID-19 vaccine is a critical component of the US and the Illinois strategy to reduce COVID-19 related illnesses, hospitalizations, and deaths. Easy access to COVID-19 vaccines are equally important. Can you give a status of the vaccine rollout distribution in Illinois? And are African-American Black men still struggling with COVID and the vaccine?
Yes, Teresa, thank you for that very timely question. Just to give a big picture, we've given out about 9 million single doses altogether. With respect to people who have been fully vaccinated, that number is roughly 4 million. And of that number, roughly 8 to 9% is African-American. And when you tease down a little bit further, 28% is African-American men, 72% is African-American women. We've known for a very, very long time that men tend to engage the healthcare system not as much as women. Oftentimes, we are targeting women to help bring their husband or their family to the healthcare system. So when we think about the strategies that we're doing to engage men across the state and African-American men, we tend to think of a very holistic approach. And furthermore, we've been taking a very multifaceted approach to be able to address equity and address populations that may not be getting vaccinated at rates representative of their population. So that means partnering with different community-based organizations. Our equity team, led by Veronica Holloway, has been doing some very targeted initiatives towards men of color, African-American men, as well as some of the town halls restoring our communities, partnering with fraternities. A shout out to Dr. Robinson. I know he's a Kappa, but these fraternities have had a long tradition of leading by service and setting a trajectory to keep our communities safe. And we've seen that to be pretty effective thus far.
Now, my next question is to Dr. Arnold. Illinois has nearly 30% of the state's 12.7 million population vaccinated. Now, this is according to the Illinois Department of Public Health website, so something you're familiar with. Some people feel that they made the vaccine too fast and that there is a possibility that their DNA can or will be altered by this vaccine. So what do you say to these statements, and what do you see as a barrier, or do you see that as a barrier or hesitancy reasons on getting vaccinated? And what can doctors do or say that will help alleviate the concerns of those who are hesitant, particularly men? And why is this so important? I know that was a lot packed in there.
That's fine. Well, first of all, I'm glad that I'm a member of Blue Cross Blue Shield, but also of AARP. I crossed that threshold and have been getting great information from your organization regarding just general issues, healthcare and others. But this year in 2021, in February, President Biden and Vice President Harris stood facing the Washington Monument with hundreds of luminaries representing the lives lost lining their reflection pool. And they noted that we had lost over 500,000 lives in our nation. After witnessing that, I asked myself, what if we had had the COVID-19 vaccines from Moderna, Pfizer, and Johnson & Johnson earlier in January of 2020? with a 95% effectiveness rate, over 500,000 of people would still be alive in our country today. Hospitalizations and deaths would have been avoided. Also, the likelihood of you having a serious adverse reaction to a vaccine is less likely than being struck by lightning. So I understand there are historical and rational reasons why we as people of color have mistrust in the healthcare system. However, be careful of fraudulent claims and misrepresentations in social media websites. There was a person with over 17,000 followers who noted people were injected with syphilis as part of the Tuskegee experiment that lasted from 1932 to 72, a span of about 40 years. The messaging content discouraged people from getting vaccinated and even from being tested. And the problem is that no one was injected with syphilis. Rather, as part of a study, they were diagnosed with syphilis and then were never treated with penicillin when it became available in about 1962. In effect, not choosing to receive the COVID vaccine would put them in the same position as people who are in the Tuskegee study, and that you would just be watching a natural unfolding of the COVID-19 disease process without an effective intervention. In fact, variolation, a form of vaccination, was practiced in Africa for more than 1,000 years ago to prevent death from smallpox and snake venom. The vaccine cannot cause COVID-19, cannot cause your DNA to be altered. I often tell students to remember that science never asks for you to believe in it, but it is incredibly unforgiving if you do not. For example, a person may decide to step off the edge of a cliff, and on your way down, gravity does not care whether you believe in gravity or not, but you may find yourself a believer at the bottom of the cliff. So people of color have been pioneers of scientific discovery since its inception. These vaccines were not rushed, but followed the usual protocols for the development with more scientific scrutiny than ever before in history of mankind. To overcome access issues, there are state websites, state, city, county, and local health departments. Go and register to get vaccinated because you can avoid the consequences, especially for men. If you are in leadership roles, many of the people who have died are 50 plus, about 98% of the deaths have been in people 50 years old and older. And so you are business owners, you're faith-based leaders, you are the legislators, your doctors, your nurses, your people who are out there serving our community. We need you.
Thank you. Thank you for that. Multiple variants. Now, this is for you, Dr. Robinson. Multiple variants of the virus that causes COVID-19 are circulating globally. And variants are in and continue to emerge in Illinois. What can you share about the variants, their concerns, hopefulness, and what we do know about them?
Thanks again, Teresa. Let me start with the really big picture, which is saying that I think while we've seen some of our darkest hours, days, and weeks over the last year with the pandemic, I am really proud of the progress that we have made, and I'm actually a lot more optimistic than I was this time last year. We've done a lot of acceleration with vaccinations, both in our local market as well as nationally. And that's really important. But I think as we've discussed today, it's really important that we don't leave any populations behind. And I think Dr. Walker's stark numbers regarding the gender disparity within the African-American community for vaccination is very concerning. And I began to see that in both personal and professional conversations. When we get to variants are not something that are new or unexpected. We see this with viral infections, not just within the coronavirus family, but even within influenza and other viruses that commonly circulate. And within the United States, there are a number of variants of concern. And the CDC has a nice classification: variants of interest, variants of concern, and variants of high consequence. And there are about at least 5 variants of concern. And we're familiar with those. They've been commonly referred to as the UK variant, the Brazil variant, or the South African variant. We also have 2, what we can call as homegrown variants out of California. And let us not forget about the incredible surge that we saw in both the incidence of infection with COVID-19 as well as hospitalizations and deaths in the fourth quarter of last year, which led to a lot of issues in Southern California with hospitals running out of beds and oxygen and the like. So that is a reminder to us that we are in a race to ensure that we can provide as much immunity to our population as possible through the vaccination process. And for the, all we have to do is turn on the news. We see the incredible heartbreak that we see occurring in India, where they're breaking world records in terms of both daily infection rates as well as death rates. It's very heartbreaking to see, but we also have our own hotspots here in the US. We have them in the state of Michigan. We see them in Oregon. And so those are stark reminders to us that we got to be vigilant. We can't leave anyone behind. We've got to ensure that folks are informed. Now, while I've talked about these 5 variants of concern that are in the US, and there have been some news reports of even one of the variants or the predominant strain in India showing up in the US, there are probably a number of other variants, right? So not all variants lead to higher transmissibility, higher rates of illness, or higher rates of death, but some do. And that's where we have the variants of concern that we are keeping our eyes on. The data is still emerging regarding the effectiveness of current vaccines, both in the production of antibody response as well as T cell responses to those variants, as well as what that looks like in individuals who have actually been infected with COVID before. So that's a body of information that continues to develop. But here's the news flash. None of us will look at an individual and say, they've got the UK variant. Oh, that person has the Brazil variant. What we do know is we look at plenty of individuals and we don't even know that they have COVID-19, right? And many times those are individuals that can be closest to us. We've seen that happen during the pandemic within families where we've had multiple generations impacted. So we're in a different place today than we were a year ago. We have a lot of good information. We've learned a lot about treatment, how to do it better. We don't have a cure, but we know a lot more about prevention and the steps that we can take for social distancing, mask wearing, and vaccination being one of the most important tools that we can move forward with implementation now. So we've got to move forward. And I think the critical thing that we've got to sort through this as an opportunity beyond educating individuals about the things we're talking about is moving individuals to making decisions. We've got to get folks off the fence. There are too many people who are navigating the misinformation that Dr. Arnold just spoke about. We want to ensure everybody's protected, everybody is getting vaccinated. And for African-American men who lost 3 years of life expectancy in the first 6 months of last year, primarily driven by COVID, we also want to ensure that our Black men are not left behind. And the numbers that Dr. Walker shared with us earlier, 28% of Black men making up the percentage of Blacks that have been vaccinated is really alarming. So we've got a huge task ahead of us. I know these gentlemen, we're up to the task. We know other folks who are up to it as well. With the help of AARP Chicago Sun-Times, we're going to get it done.
Yeah, you said earlier that good information. This is excellent information, and I am so happy to have you guys here with me. If you remember the old song in the 70s, it's like it was called "It's Raining Men," and that's how I feel. I'm in just a pot, and I've got you guys all around me. Thank you. So at this time, we want to dig just a little deeper. But this question is really for all of you. But before I ask burning questions, AARP does not want to give you or any of our listeners the impression that we think Black men do not take care of themselves, or that Black men do not believe in the virus or the vaccine. But in saying that, one of the reasons we wanted to have this event and conversation was because men, Black men especially, are still lagging behind in the COVID vaccinations. So why do you think that is? And what messages do you think they need to hear?
Teresa, I think that's a wonderful point that you just mentioned. And I don't ever want to put forth the assumption that Black men don't want to take care of themselves. They very much do. They very much want to take care of themselves. They also very much want to take care of their family as well as their community. I think the message that we want to make sure that our communities understand is that this is a route to be able to make sure that we are taking care of our family, we are taking care of our communities, and this is the step closer to getting us back to some form of normalcy. That video brought up some very, very important points. It brought up housing, it brought up jobs, it brought up so many indirect issues that can compete with people to prioritize their healthcare. And unfortunately, African-American men have different priorities relative to different groups based on the structural drivers that we face. And when we think about structural drivers, it's important to think about that these are policies, institutions, issues that can exacerbate disparities. We brought up the internet, we brought up historically housing and generating wealth. Some of these policies are intentional and unintentional. But once we know about it, it's on us as a community to address it and play offense. So that means we need to get everybody on deck. All the leaders that Dr. Arnold just mentioned that have some decision-making authority in terms of hiring or working with large groups of communities, our faith-based leaders, and encouraging very directly why we need to get our communities vaccinated. And then lastly, I also want to bring up an important point about having awareness about our communities. Oftentimes, because our communities are less vaccinated and the positivity rates are much higher, your environment is by definition very much different from different environments throughout the state. So that means it's even more important to make sure that we're masking, physically distancing, washing our hands, and still communicating to our loved ones about the importance of getting vaccinated. We all have a very personal relationship with COVID-19. And one of the very most difficult issues that we had to deal with was just the frequency of Black men that were presenting to our emergency departments, the frequency of the discussion of talking to different family members that can't necessarily come in to see their loved ones or be admitted to the hospital, as well as the frequency of jobs and communities that were affected by complete closure and that are having a difficult time moving forward. So it's going to be very much all hands on deck. Talking to our communities, talking to our advocacy leaders, and holding people such as myself accountable to make sure that we are discussing very poignantly about what we're doing for our communities in order to be able to move forward.
Can I add one thing to that? You know, Dr. Robinson in particular, and he has been really a big champion of equity, and I know Dr. Walker's aware of it as well. But the number of people who are actually in the healthcare industry, particularly Black men, has been stagnant for about 120 years. You know, for the rise in the number of percentage of Black men who are doctors. And without having your foothold in the academic arena, without having it within your schools from elementary through high school to college and professional school, being locked out of that institutionally has caused a large knowledge gap within the community. And that's something that we need to start, you know, making sure that Black men and women are aware of the issues surrounding healthcare in a much more tangible way. And if you as Dr. Walker was saying, if you're a laborer and the choice is between you getting a paycheck to feed your family and put food on the table for your children and going to get a vaccination, and if you do happen to go and get the vaccination and the employer says, you know, you're a low wage earner, so guess what, I have a replacement there, you don't need to come back. You know, so those kinds of leverages that people have on the health of individuals in the community also needs to be addressed as well.
Dr. Arnold, you're like a mind reader. You hit on some of the things I'm going to talk about a little later. But first, you know, I'm married to a Black man, and quite frankly, I have quite a few Black men in my life. So, but fortunately, all the males in my family, they've all been vaccinated. But we've heard from friends, we've heard from people, just people in general. They keep talking about the mistrust, and you've hit on this a little bit, specifically about the experience of the Tuskegee Airmen, and for women, even Henrietta Lacks. So, and that's just a few names that come up and a few reasons. But again, for all of you, I'm sure you guys hear that too, and I know you do because you mentioned it earlier. But even though that was a long time ago, do you think we as Black people need to move forward? Now, I don't want anyone to take away my Black card or anything, but we don't want anyone to forget, of course, because you learn through history. But don't you think we should just move forward and maybe find other reasons, if there are any reasons, but we should just get vaccinated? And I think as we look to our men as being the head of our house and as leaders in our communities, how do we alleviate some of that anxiety and even the frustrations to get our men to be a little more proactive? So do you think part of the hesitancy is not seeing a lot of or having access to Black leadership in medicine? And I know some may feel more comfortable if they have a Black doctor, or they think they would relate better. But then there's some that may not even matter, because they may feel like some of the Black doctors may have drank the Kool-Aid. So what do you say to that?
Teresa, you asked a number of highly complex questions, which we are fully capable of disentangling and addressing. So let's begin to parse it out, and I'll pause after a while and my colleagues jump in. So on the first question of whether we should just move forward, I think the principal task that is shared by Dr. Walker and Dr. Arnold and myself is to distinguish the opportunity before us to get vaccinated against COVID-19 today from many of both the historical and the contemporary disparities that we see both in society and in the healthcare delivery system. So we're not here to say that there's not good reason for there to be some distrust amongst African-American men within the healthcare system. But what we are here to say is, as Dr. Arnold noted, this is one of the most scrutinized vaccines that we've seen in modern history. We are in the midst of a pandemic that's killed more than 550,000 Americans, millions and millions of people who've been infected, families that have been torn apart. We're in an existential crisis currently, and we feel comfortable as both medical experts and individuals who are historians of medicine, distinguishing between the decision that needs to be made around getting vaccinated and those historical concerns. And I think we're united in affirming that it is safe and in the best interest of members of our community to get vaccinated against COVID-19, because you're making a decision between acquiring some protection and having no protection at all. And we know the consequences of no protection at all are very significant. Again, just take a look back at our experience in California, what's happening in Michigan, what we see going on in Oregon, what we see across the seas in India. As Dr. Arnold noted, Black men are amongst the most underrepresented population in healthcare. And Dr. Walker and I have spent a lot of time in the emergency department. So we've seen wives, girlfriends, sisters bringing their brothers, husbands, partners, significant others in kind of at the last minute when things are really going bad, because they haven't wanted to come and see the doctor. And most often that concern is not expressed, hey, I know what the doctors did at the Tuskegee syphilis experiment, or what happened to Henrietta Lacks. Those are important. And there are a number of additional historical and contemporary examples of discriminatory and unethical care within a healthcare delivery system that's passed down orally from generation to generation that informs that distrust, that sort of reluctance to seek care, as well as many of the social factors that Dr. Walker talked about earlier. So all these things kind of come into play pre-pandemic that, again, we're just kind of less reluctant to go and seek that care. And I've seen that in my own family. It took me a while to understand it. But there was a study done in California, and I'll pause after this, just a few years ago, that evaluated the likelihood of African-American men to seek preventive care and to have their health issues addressed. And this randomized study did show that when Black men were paired with Black physicians, they were more likely to follow the medical guidance of their providers or seek additional preventive care. So what it's saying is that we also have to ensure that we have a healthcare system that can meet populations where they are. So if we weren't talking about Black men and we were talking about individuals that we're primarily Spanish speaking versus English speaking, then we need to have a healthcare system that can meet people where they are linguistically. If we were talking about it from a gender perspective, where perhaps women may be less likely to seek gynecological care from a man physician, then we need to have a healthcare system that can help meet women where they are with that gender concordant care. So that also is a component that we understand, but it's having that panoramic view that I think positions us to also be authentic and credible in distinguishing getting vaccinated against COVID from those other real historic and contemporary issues that impact the decisions of Black men to seek care.
Thanks, Derek. He summed it up so eloquently. The only thing that I would like to just bring forth is that oftentimes we talk about this often as clinicians. After you do all the training, after you do the 4 years of medical school, after you do the 3 to 8 years of residency, you're highly trained to save lives or to make people feel healthier. But one of the biggest challenges is understanding people's lived experiences, regardless of where people are from. And so you can't separate people from the history or the oral history that has been passed down. It's very reasonable. And one of the things that we've been stressing throughout the year is making sure that you can get an informed opinion. And oftentimes people trust different people. So when we talk about faith-based organizations, barbershops, we did a statewide barber town hall for barber leaders to talk about frequently asked questions around COVID-19. And why would we do something like that? Well, it's very well studied. There's been several randomized control trials showing the effectiveness of disseminating medical information to communities of color through barbers. But as long as the science and the integrity of that is in the foundation of the delivery, why not do it? I think we know very much that people are more likely to commit to medical advice from people they trust or people that may look like them. And we want to make sure that our communities are aware that there are people that look like them, that have their best interests, that are evaluating the science. So for example, National Medical Association evaluated the trials. They looked at it specifically to make sure that there was no increased adverse reaction and that the treatment and the protection did what it was supposed to do for communities of color. And we communicate that. And I think that we have seen some improvement around vaccination hesitancy by having those discussions. But with respect to moving on, I think it's important to make sure that we're aware of history. It's important to name it, but we also want to make sure there's urgency and to think about the policies and structures that can help provide solutions. So Dr. Arnold and Dr. Robinson talked about the pipeline of African American men pursuing medicine and how we need to do more. It has many implications. It has not just clinical delivery, but it has research implications. What are some of the studies that we're looking at? What are some of the scientific innovations that we're looking at in our clinical and healthcare delivery systems around treatment, around medical intervention? When you don't have enough people that represent a certain group investigating those issues, there's going to be a lag in innovation moving forward to be able to address those issues. So there will be a multiple of initiatives that we are learning and that we need to be doing due to COVID-19 to be able to avoid from being in this situation in the future.
Yeah, and one thing I'd like to add to that, is that people who, men, and this goes back to what Dr. Robinson was saying, and he was talking about the loss of 3 years of life. Now, one of the things that happens is that if you lose your life, you can't take care of your family. You can't do all the things that you have been putting yourself to work for every day. So you have to understand it's not just about you as an individual, as a man. It's about your entire family structure. As a matter of fact, it's also about your community and your extended family, your friends, because if you pass away, you also have the potential for losing your Social Security money. You lose your pension. those things that keep a community viable. So it's also an economic drain on the community to lose people. You also lose the experience and the wisdom to guide other people along the path. So you can have a master carpenter or bricklayer that's actually teaching young people how to do these jobs. So you are a vital part of the community. And the thing that I think Black men have to understand is that this community is what it is because of who you were and have historically been. So we need to stay in that role and make sure that we take care of ourselves and families.
Dr. Arnold, I would just say that that's real talk.
Yeah, I was getting ready to say, amen to that, So and it sounds like basically what you're all saying as well is that we have to meet people where they are. So we got to go to them. If they're not coming to us, somehow we have to get into the community to get out to them. And that's part of the reason why we're doing what we're doing today. So this is for all of you again. So we're likely to agree that depending on where you live, it determines your quality of healthcare. So as well as your delivery of care. So for example, the north side of Chicago versus the south side, rural areas versus city or suburban. So how do you think COVID has influenced that challenge? And is that parity getting any better?
It's influenced it very much. I think the parity is getting better because we have been thinking about different initiatives to be on the offense to address those issues. For example, one of the issues that you mentioned are pharmacies. Pharmacies aren't equitably distributed throughout the state of Illinois. It's very likely that there will be more pharmacies on the north side than the south side of Chicago, which means more access points to get vaccinated, very much a structural issue. But with respect to understanding that these structural issues exist, what are some of the issues that we're addressing to be able to make that much easier? Providing an opportunity for walk-ins. I know the city is doing specific vaccine pop-ups in certain communities that have lagged before in the past. We're doing mobile vaccinations throughout the state for regions that may not be getting as much uptake as others, particularly for marginalized communities. We are doing ambassadors programs, public health initiatives for community-based organizations to register and disseminate some of the scientific literature in a manner that is honest and that can help save lives. And I think that's essentially the root issue of it. We have to make sure that we're on the offense and then long-term thinking about how we got into this situation. And I think a good example was broadband internet. I don't know if that was at the top of the list when people were thinking about a structural barrier up front, but it has led to disparities in terms of who gets vaccinated, who doesn't, who has a family member that can help navigate the different applications to advocate for their communities. And faith-based organizations and community organizations have been working extremely hard in terms of addressing those issues. I've met with churches who have registered their communities throughout the pandemic because they know that that's an issue. So I'll stop there and pass it to my colleagues.
I'll just build on Dr. Walker's comments around looking to the long term, because there have been a lot of investments that have been made here in the short-term sprint to accelerate vaccinations, both in the public health space, where resources have been long needed with community-based organizations and social services. But we would all be remiss if we didn't put a spotlight on the endemic chronic medical conditions, high blood pressure, heart disease, diabetes, obesity, kidney disease, and those other factors that are just disproportionately high in our communities that really put us at greater risk for dying from COVID-19. And so many of the social factors, including the healthcare infrastructure, which is a component of that, that have contributed to these long-standing challenges that we see in our communities have to be addressed. And so one of the things that we have to ensure that we keep our eyes on as we move through and hopefully beyond COVID-19 is that we don't lose sight of the need to address those infrastructure and social support gaps. Otherwise, we're still burdened with that significant endemic chronic medical conditions that contribute to shorter life expectancies, lower productivity in the workforce, financial risk for families, which also impacts the health status of the entire family and community. And so those things we've got to ensure that they're focused on. Again, we're mitigating some risk around vaccination, but that's a means to an end with regard to this pandemic. But we've got an epidemic of other issues that have to be addressed.
So I'll move on to Dr. Arnold. Now, we might not have touched on this enough. There's other reasons that Black men might be hesitant to get vaccinated. And that's because, and I think we hit on this a little bit earlier, but they can't take off from their jobs. They might be underinsured, so they don't see a doctor regularly, and they don't get routine health care. I think, Dr. Robinson, I think you had hit on that earlier as well. But so what do we say to these men if they're in those similar situations?
Yeah, I think one of the things is that, first of all, the system has to be a little bit more responsive to their needs. If they are, in a workplace environment, as far as hours that are available for vaccination, scheduling work shifts, you have some people, I remember talking to one person who was a Walgreens executive who said, the times that people come in for their medications are 9 a.m, 5 p.m. right after work, but then at 3 o'clock in the morning, because you have shift workers. So we have to really take into account people whose schedules they're doing 2 jobs, just to maintain ends meet for their family and to keep them. So you have people who work 12, 14 hours a day and, very little time for sleep and rest and relaxation. So, trying to put into that some other activity they have to do can be very difficult, and it's understandable. But again, getting back to the points that Dr. Robinson and Dr. Walker were making is that the consequences of not getting vaccinated, of not taking care of your health, for your high blood pressure, your diabetes, can be devastating. It can lead to the collapse not only of your own health, but your entire family structure and everything you're working for. So we really have to make sure that people understand that that is a risk that they're taking. As far as people having other issues, there is a lot of misinformation and disinformation. Now, misinformation is when someone doesn't know something and they keep talking about it, right, on the internet or, through social media, and they just have the wrong information. But disinformation is when people are actually intentionally putting information out there that's false, knowing that it's false as well, about vaccinations, about, thiomersal, about other things that can happen to you. So we can't fall into those traps. That actually traps you into a cycle where you can spiral down and actually end up hospitalized on a ventilator or with death. And I've spoken to Dr. Robinson and Dr. Walker, who are both ER, high-level ER physicians who understand what the issues are surrounding that. That involvement in the healthcare system. And in particular, Dr. Robinson always talks about this issue about people who have asthma and the difficulty with getting them off of ventilators, once they have been hospitalized and enter the healthcare system. So supportive care is something you can do. But, if you go and get a vaccination, now I got vaccinated myself, as I think my colleagues have as well. And, I tell people the story, I got vaccinated on my left shoulder. The first vaccination wasn't bad. I saw I did a 2-dose, had no problems with it really, just a little bit of soreness. The second vaccination, I had a lot of pain in my right shoulder because I was running to a meeting and hit my shoulder on the door. But the left shoulder, where I got the actual vaccination, nothing. It was more pain in my right shoulder from doing something crazy by running and not paying attention to where I was going. So, and some people have, fever, they have, they may have some aches and pains. They may feel under the weather for a day or two after being vaccinated. But guess what? That's a heck of a lot better than being on a ventilator for 6 weeks and being in the hospital and not knowing whether you're going to come out of it or not. And I'm not sure if my other colleagues have something to add to that, but there are, many reasons why, African-American men don't come forward to avail themselves of the healthcare system, as we were mentioning. But this is something I think it's more instilled in women from early age because of things for pap smears and gynecological, breast cancer, all those kinds of things are more pronounced. But you really don't see that kind of motivation in young men going in to get healthcare treatment because there seems to be no reason to go in. But there is a reason to go in. You're trying to make sure you don't develop chronic disease like Dr. Robinson was mentioning, and you take care of yourself.
So, Dr. Robinson, one thing we're hearing from a lot of our members are, I've gotten my vaccine, so now what? What do you say to those folks that are looking for normalcy since we're definitely not quite there yet?
So, Teresa, I'm on this webinar with you with two public health experts. So I'm going to start by saying we want to continue to listen to our public health experts and follow the guidance that they provide. We really value them. I think it's just important to state that. Folks didn't realize it before, they realize it now. So we appreciate the service that you all have provided, Dr. Arnold, Dr. Walker. I think one of the things that I have shared with folks throughout the pandemic is the need to move forward with some humility with the virus, because we're still learning. For example, we're just beginning to realize that, in one study, 60% of people who had COVID-19 and didn't get hospitalized had a higher risk of dying within the next 6 months than individuals that did not get infected with COVID-19. So there's a lot of stuff that we're still trying to figure out. So, be humble, continue to be mindful of the importance of, wearing our mask when we're, in close proximity to other individuals, try not to be in that close proximity, encouraging other individuals to get vaccinated, and just, using good common sense. Realize that we are still in a pandemic. We're not out of the pandemic yet. We can't look at an individual and tell, whether they have COVID-19 or not. That's just the nature of this illness. And we're still in the fight. We're still trying to completely, tamp down this virus in our community so that we can get back to that state of normal and get our economies reopened and rekindle our relationships in a way that we like, to engage with each other. And we're making progress. We're not totally there yet. And so we've got to continue to take measured steps going forward. So that will be my guidance to them. And when we're talking about your members have a bit more wisdom than some other segments in our society. So we want to use that wisdom, use that good common sense that folks used to talk to us about a long time ago, and just ensure that we're, again, being humble, following our public health professionals' guidance, and maintaining recognition that we're in a pandemic. There's nothing in life that's guaranteed, right? So vaccination reduces greatly your risk of getting infected, greatly reduces your risk of being hospitalized, but it's not zero risk. It's not zero risk. So we want to ensure that we proceed with caution, and I'll pause there and let our public health professionals chime in.
Thanks, Eric. To add on is just to make sure that we all realize our role in fighting this. I think when we think about public health, it never really got as much attention. Nobody really cares about it until you need to care about it, such as the current context that we've been in over the past year. But the reality is that every action that each and every individual makes, from masking to distancing to washing hands, has impact. And we see different examples in a variety of ways. Dr. Robinson brought up India. As you can see, we cannot move forward from this pandemic unless we are cognizant of how others are doing. In this case, this is miles and miles and miles away. But you have seen our country take action in terms of providing vaccine, providing support. But the concept is no different from at the most local level. Different regions throughout the state have different positivity rates, different sickness levels, different health profiles. And as we're aware of that, we have to make sure that we are listening to our tool set, masking, washing our hands, physically distancing, and getting vaccinated. So if you know somebody that's not vaccinated, if you know a family that's not vaccinated, make it a group outing. Figure out where you can get vaccinated. You can go on the IDPH website, you can go on your local Department of Health website and figure out where you can take that action. And by thinking of it from that perspective, we can move the needle to getting back to some normalcy. And as the positivity rates continue to go down, as you can see, once vaccinations have become plentiful, we've seen the hospitalizations go down. Our country is starting to feel a little bit back to normal. But it's going to take a group effort, and we need to make sure that we're aware of how our actions affect others and the community at large.
And the one thing I'll just add really quickly is, what we need is another movement. COVID-19 vaccinations matter. And we need another movement, Black Men's Lives Matter. we really need to have, these statements being out there, because people, it gives them a focal point to understand how valuable they are to us as a society and to protect themselves.
Well, maybe we'll have to work together and do something about that. So, Dr. Walker, I think I'm just going to pose this to all of you, just because our time is coming to an end. There's some new data that was presented by the Illinois Department of Public Health, and it's showing that our state has administered nearly 150,000 second doses of the COVID-19 vaccine. That just in the Illinois nursing homes. So can you explain how our state's most vulnerable nursing home residents are continuing to receive the vaccine opportunities? And how do people of color receive a better health outcome and experience at nursing homes across the state?
Sure, no problem. So at the beginning, we partnered with Walgreens, CVS to directly vaccinate our nursing homes. And since then, we've developed partnerships with nursing associations as well as pharmacies to be able to register to eye care. So for example, if you have a certain subset within your nursing home that may not be vaccinated, you can get a direct allocation. Another component to think about is as a family member, if you have a family member in a nursing home, taking a close look to seeing how well people are adhering to masking policies, distancing policies, and how much communication is going back and forth around if there's outbreaks or not. Those are some of the solutions that can help address some of our nursing homes that are in some of our most difficult communities, as well as make sure that we can get the vaccines to those communities as needed. And then lastly, Biden put out a message that he wants to make sure pharmacies have a walk-in option. So that will be a lot more plentiful. And then lastly, the direct relationship with our nursing homes, you can get your family vaccinated as well. So if you have not been able to see them with the liberty that you have before in the past, now there's an opportunity to get your family vaccinated as well.
Well, and lastly, COVID-19, it has made a profound changes on our healthcare policy. What do you see as long-term policy changes that will remain post-COVID? And how can people of color, specifically our Black men, come out with much better health outcomes?
Well, I think part of it is what you were saying, Teresa, is you were mentioning the leadership role in the family. Men need to realize that they have a role to play in preserving the health of their family members as well. And, we were talking before, I've spoken to Dr. Robinson and Dr. Walker, about these different issues before, but having, young people in particular, make sure they take care of their seniors. In many other countries, getting back to what Dr. Robinson was saying about the reverence for, people who are older, many countries revere their elderly. They will kiss their feet, their hands, and understand the relationship that the person who's a senior in their family has to them. So we need to have our same kind of reinstitution of that kind of feeling in this country, where the young will take their grandparents to get vaccinated, will take their, parents to get vaccinated. And so this kind of thing, we need to have that in the public health system. But I think from a policy perspective, it really has far-reaching implications. What Dr. Robinson was mentioning and uncovered all these things that were already there, the social determinants of health, the social inequities, everything that's underlying our infrastructure in our communities. And, as an approach going forward to address the things that Dr. Robinson and Dr. Walker were talking about, the chronic diseases is essential. That has to be health in all policies, health in how we really look at the community. And I'll leave it there. Thank you.
Well, we are almost out of time. I hate that, but because this has just been wonderful. But on behalf of AARP Illinois, I want to thank everyone for taking part of today's virtual conversation on the coronavirus pandemic and, of course, the COVID-19 vaccine. So we've been talking with Deputy Director Dr. Garth Walker of the Illinois Department of Public Health, Dr. Damon Arnold, adjunct professor at the University of Illinois College of Medicine and School of Public Health, as well as medical director for Blue Cross Blue Shield of Illinois, and Dr. Derek Robinson. Dr. Robinson, Vice President and Chief Medical Officer for Blue Cross and Blue Shield of Illinois. We want to thank you again for joining us today. So if you have closing, I have to just give you like a minute. If you have a closing statement, if not, let's see, what's up? Well, I guess I hear none. So once again, AARP, we thank you for your time and sharing these critical insights for our listeners today. We appreciate all the hard work and the leadership that you and your teams do. A special thank you again to the Chicago Sun-Times for hosting us. I'd like to add, in the face of this crisis, AARP continues to provide information and resources to help our older adults and those caring for them. From the virus to getting their shots, to getting the vaccinations, and helping prevent its spread to others, as well as taking care of themselves. If you need more information about the coronavirus in Illinois, you can go to dph.illinois.gov/COVID-19. And if you want to register for the COVID-19 vaccine, you can call the state of Illinois COVID-19 vaccine appointment hotline. That number is 1-833-621-1284. And Cook County residents, you can go to vaccine.cookcountyil.gov. And that number is 833-308-1988. Again, that number for the hotline is 1-833-621. 621-1284. So I want you to know that AARP has been sharing information and engaging in rich discussions on issues ranging from the Illinois, from health equity to caregiving, as well as economic security to connectivity and social isolation. So dozens of individuals, as well as organizations and leaders, including the Speaker of the House, they've signed a pledge to join us in disrupting disparities in aging and to continue the work toward racial equity in aging. So if you haven't joined yourself, we ask you to sign our pledge to help us and join in this work and this journey by going to www.disruptdisparitiesIL.com/sign-the-pledge. Again, I'm Teresa Jones, Associate State Director for AARP Illinois. Thank you so much and have a wonderful day. done.
You did great. Oh my God, you did so good.
You would say that.
No, honestly.